Welcome back to the Michigan Business Beat, brought to you on the Michigan Business Network. Chris Holman here, fresh from the Detroit Regional Chamber of Commerce's Mackinac Policy Conference. And here's a guy who a lot of the chat was about, actually, healthcare. Brian Peters, CEO of MHA, the Michigan Health and Hospital Association. And Brian, how are you doing? And you were a lot of the chatter up there because your industry is so huge.
Well, thank you, Chris. Great to see you as always. And you're right. In fact, on the island at the Detroit Regional Chamber Conference, we were very pleased to share the results of our most recent survey, which of course covers all of our hospitals and health systems throughout the state of Michigan. And we have been focused, as you know, on the healthcare workforce for some time now, but we were very pleased to share that over the course of the last 12 months, Michigan hospitals and health systems have actually hired 61,000 individuals. We have dramatically decreased the vacancy rates that we were witnessing throughout the state a year ago. And so we are on the right track. Now, we still have some 19,000 job openings today in Michigan hospitals. And so what I would tell you, and for all of our listeners, healthcare remains a tremendous place to build a career. This is an aging population where the demands on healthcare services are only going to grow. And so healthcare remains a wonderful place to work and to build a career.
Well, it really does. And of course, your latest economic impact of healthcare in Michigan report was released last week. Tell us a little bit about that. Tell us about the actual report and how it comes to be.
Well, absolutely. We began doing this over a decade ago, where we really believed at that time that most Michiganders and most Michigan businesses maybe thought about hospitals and healthcare generally as a vital part of our communities because of the services we provide, those vital healthcare services. And that's obviously true, but we wanted to really shine a light on the fact that healthcare is an economic engine as well. And as it turns out, what we found at that time, and it's still true today, Chris, is that healthcare is actually the largest employment sector in the state of Michigan. Hospitals alone in Michigan employ over 217,000 individuals. That's $47 billion in wages, salary, and benefits for hospitals and other healthcare providers, if you put those together. So it's just a very significant economic impact for the state. But I think the reality is we understand that no matter what line of business you're in, it's going to be difficult to recruit and retain qualified staff in a given community, whether that's urban or rural, unless there is a hospital and a robust healthcare infrastructure in place that can provide access to care, whether that's 24/7 emergency department care, whether that's the ability to deliver babies for folks who want to raise a family. These are really important economic considerations.
So there is this great, very important relationship between healthcare and the state's economy we're aware of. What types of businesses are hospitals looking towards to provide staffing and workforce solutions?
Well, absolutely. And we found really through the COVID-19 pandemic in particular, a dramatic need to work with partners. And what that means, in essence, is nurse staffing agencies that go beyond just nursing staff to clinical and non-clinical employees in the healthcare system. We rely on those organizations to identify folks from other parts of the state, but also from other states throughout the country who may have a desire to fill a particular opening. And those organizations help our member hospitals and health systems to matchmake, in essence, to bring those folks into those needed positions. And we continue to use those services. In fact, the MHA has an endorsed business partner called AMN Healthcare. They're one of the largest firms in the country in this healthcare workforce space. And so we are deep into this discussion, and it's an important one that will continue.
All right. So some of us run a calendar year, some of us run a fiscal year. You are concluding your program year. Tell us about some of the areas of success you've had.
Well, thank you, Chris. And yes, we wrap up our MHA program year this month, June. Our new program year will begin July 1st, but I'm just delighted to reflect on the success we've had over the last 12 months. Of course, healthcare is an incredibly challenging environment, but working with the governor, working with the state House and Senate, we have produced a very significant degree of support in terms of funding through the Medicaid budget deliberations, certainly public policy that has supported our members. Sometimes it's not just what we've done, but it's what we have not done. And you and I have talked about this issue in the past. We have not advanced what we consider to be very harmful nurse staffing ratio legislation that sounds good on the surface, but would create a dramatic upheaval in the healthcare infrastructure and really, I think, reduce access to patient care. So we have not seen any forward momentum on that harmful legislation, and that's a really good thing, I think, for all Michiganders at the end of the day.
Well, you guys have done nothing but good things for that healthcare industry. Brian Peters, CEO of MHA, the Michigan Health and Hospital Association. Thanks for joining us, my friend.
Thank you, Chris.
Always good to see you. You are watching the Michigan Business Beat on the Michigan Business Network. I'm Chris Holman, and we'll be back with more.